IGEPHA im Gespräch. Der Podcast der Austrian Self-Care Association.
Hello and welcome to IGEPHA im Gespräch, the podcast brought to you by the Austrian Self-Care Association. I'm Christina Nagela, your host and the Managing Director of IGEPHA. In this season of our podcast, we are on a mission to gather the best self-care strategies from around the globe. Through discussions with representatives from various international self-care organizations, I aim to uncover the secret ingredients for enhancing self-care within different national healthcare systems. Today's episode takes us to the United Kingdom, a country pioneering innovative approaches to integrate self-care into healthcare. Many of the groundbreaking ideas being implemented in government initiatives can be traced back to PAGB, IGEPHA's counterpart in the UK. I'm truly thrilled to dive deeper into the UK's self-care solutions and welcome Farhana Hawthorn from PAGB to learn more. Welcome to our podcast, Farhana.
Thanks, Christina. Thanks for having me on your podcast.
Before we dive into the interview, let me introduce you to our guest. Farhana Hawthorn, who currently holds the position of Head of Public Affairs and Communications at PAGB, the Consumer Healthcare Associations. In her role, she spearheads PAGB's efforts in the realm of self-care. PAGB serves as the voice for manufacturers of branded over-the-counter medicines, self-care medical devices, and dietary supplements in the United Kingdom. Prior to her turn to PAGB, Farhana worked with a patient organization providing support to individuals dealing with rare genetic and undiagnosed conditions. I'm delighted to have Farhana here with us today to share insights into the innovative approaches for crafting a self-care strategy in her homeland. To kick things off, Farhana, here's my first question for you. Earlier this spring, PAGB made an announcement via a press release revealing that a substantial portion of the blueprint for a self-care strategy had been integrated into a fresh program designed to alleviate pressure on the British healthcare system. Could you elaborate on how this came to fruition?
You're absolutely right. Earlier this year, as a direct result of our campaigning, the government and NHS published the Primary Care Recovery Plan, which incorporates many of the things we had asked to see in a UK self-care strategy. Now, I want to just give you some background to this, if I may. As you can imagine, success didn't happen overnight. At PAGB, we've been talking about self-care for over 50 years. We've been specifically campaigning for a national self-care strategy since 2016. So even though the benefits of self-care are widely recognised and accepted in the UK, what we didn't have was a national policy or a strategy that ensured that self-care policies were being implemented consistently in our health system. In fact, the last time we had a self-care strategy in the UK was 18 years ago in 2005. So we really needed coordination at a national level, and that's why PAGB brought together a coalition of interested stakeholders who are willing to come together and collaborate to push forward the self-care agenda. This coalition is called the Self-Care Strategy Group. It's comprised of representatives from medical royal colleges, professional organisations and trade associations representing clinicians, commissioners, suppliers and pharmacies, and of course PAGB. In 2001, the Self-Care Strategy Group published a blueprint which detailed 9 key asks in terms of what we wanted to see in a self-care strategy. Collectively, we called on the government to address inequalities in health literacy, to teach children about self-care in schools, to introduce self-care modules in healthcare professionals training, and to better integrate pharmacy to support self-care. So, for example, by enabling community pharmacists to populate medical records. So this blueprint has been the key document that we've used to influence government. And thanks to our work and that of our strategy group partners, we were really pleased that when the primary care plan was published earlier this year, that 7 out of the 9 key asks were committed to. So essentially what we have in the UK is national self-care policy, or a self-care strategy in all but name.
Sounds great, but a long time you've worked on it.
Yes.
Which measures have already been implemented?
So progress is being made, but one area that the plan committed to look at, which is really quite exciting, is reclassification. And this is something that PAGB is directly providing support for. So at the moment, we're working with the Department of Health and Social Care here and our medicines regulator, the MHRA. And the idea is that we want to kind of help widen access to self-care, and our particular role at PAGB is helping to develop a list to identify health categories and medicines that can be switched. So that's really exciting.
So has there been a switch already?
So we're in the process of identifying which health categories can be, but in line with this work on reclassification, one of the other work streams is looking to improve the process to make sure it's streamlined. So those things will work in conjunction.
Okay, great. Well, because here in Austria, we would say you are far ahead of us with switching, but that might be another different. What does this mean for the population? Do you have any examples for us?
So the primary care recovery plan is welcome news for patients and the NHS, as well as the wider healthcare system. It gives people more options for how and where they manage their health. The plan has the potential to embed self-care in the primary care pathway and empower patients and alleviate demand on frontline services. We undertook or commissioned a report recently, and we found that on average, UK employees report that they rely on OTC medicines to be able to work for 5 extra days a year, thanks to self-care and OTC products. So it can have a huge impact on people.
Very impressive data. From a PAGB standpoint, which key arguments hold particular significance in persuading the public about the importance of a national self-care strategy?
So I think broadly there's always been support for self-care, but in terms of consumer confidence to self-care and the attitudes towards self-care, the biggest driver here in terms of shifting public attitudes towards self-care was the pandemic. So during this time, the government advice to people was that they should stay at home, protect the NHS and save lives. And that's essentially a message of self-care. So in response to the first wave of the pandemic, almost 1 in 4 people said that COVID-19 had changed their attitude towards self-care. And then 7 in 10 people who would have not considered self-care as their first option before the pandemic said that they were more likely to do so. So I think for us in the UK, definitely the change and the shift in attitudes came from the pandemic and the lessons learned and the behaviour change.
When you examine the data, what metrics are used to gauge the effectiveness of a national self-care strategy or specific initiatives in the United Kingdom?
So at the moment, in terms of statistics and data that show the benefit of self-care, that's something that we do have. So we know that 64 million people in the UK will experience at least one self-treatable condition. And of these 64 million, 61 million will use OTCs to manage their self-treatable conditions. And as I mentioned, it allows people to work an extra 5 days, but it helps avoid 164 million work days per year in total. So that's huge. So in terms of the benefits of self-care, we have that. But with regards to the implementation and the effectiveness of the self-care policy in the UK, this is something that we're actually working on right this moment with the self-care strategy group. We're actually going to be publishing something next month. So, and that's to coincide with the 2-year anniversary of when we first published our blueprint. So I can't give too much away, but I can say that we've identified 3 tests for policies on self-care. So the policies we're saying must 1, empower people, 2, reduce health inequality, and 3, reduce demand on the NHS. So those are the kind of measures that we're looking for.
Thank you for sharing these insights into the groundbreaking initiatives for introducing a national self-care strategy in the UK. As a closing note, may I ask you for your recommendation for us here in Austria? What key considerations should we bear in mind when creating our own national self-care strategy here in Austria?
I think success in the UK was achieved through collaboration. So anything that can be done to bring together key stakeholders and align on what you need from a self-care strategy would be my recommendation.
Thank you so much. And I guess we need a long breath for really transferring like the PAGB had. Thank you so much, Farhana, for providing us with these valuable insights into the commendable efforts of PAGB and their successes in implementing a self-care strategy for the people of Britain.
Thank you.
And this interview has underscored the myriad benefits that self-care can bring to both the healthcare system and the general population. To fully harness these advantages, it's crucial to consolidate efforts and integrate them into a well-crafted self-care strategy. If you share our enthusiasm for strengthening self-care measures, we encourage you to get in touch with us. Feel free to reach out via email at office@igepha.at. We appreciate your interest in our podcast series and bid farewell to all our listeners. Stay tuned for the next episode in our new season.